Hey, quick tip for generating interest in your product. People like things that are new and novel. They like to see things that they haven't seen before. So, new could be brand new, or anything that's new to somebody else is also new. So I always tell the person that I'm talking with when I'm calling on them is that we've got a new product, brand new product. What's up, vlog? It's Monday morning, so back at it, obviously. It's actually 8:30 almost. Stopped at a surgery center this morning where a guy who uses our product, he had 2 shoulder scopes. So I stopped in there thinking that we had that I had a couple of cases on the books, but they were both teenager patients, and they were labral repairs, and he only uses it in the subacromial space, so he's only using it on rotator cuffs, subacromial decompressions, etc. So no cases, unfortunately, on the books, but you know, it's the way it goes sometimes. A little frustrating, but he's got cases on Wednesday, so we'll do those. So now I am making calls, following up. So back behind me, over there somewhere, is a surgery center that I stopped in about a week and a half ago. So there's a doctor that's used our product at another location and wants to use it at that location. I met with the materials manager there. The problem that we're running into, because the materials manager was like, yeah, you know, I'm open to having you come in, trial it. There's another doctor that operates here that should trial it as well. Problem is, they're on a contract. They're on a GPO, a group purchasing organization contract, meaning that a large conglomerate of facilities get together and they have one company, this contract, manage all of their pricing with other companies. Problem with that is we're not on that contract. So they would have to be buying our product off contract. It's not impossible, it's just more difficult to do. So I'm going to be stopping in there as well. I'm walking into the hospital here. So this is a hospital with the surgery center next door. Walking to the hospital here. I'm going to stop in here first and then pit stop at the surgery center, and hopefully, you know, we just got legwork to do to try to get the product in at an account that is on a GPO and on a GPO that we're not a part of. Now with this hospital, another doctor that has used our product and wants to use it at this facility operates here. He texted me last week and was like, hey, you're welcome. I'm doing your job for you. I'm getting your product in here. So he was being a little bit of an ass, but trying to be funny at the same time. So all in all, he's hopefully going to help me get our product in here so we can start using it. So I'm going to be touching base with the OR director, hopefully, materials manager, anybody in supply chain that I can find, and figure out how to get this product in. So yeah, that's what we've got going. All right, so the materials manager that I was trying to meet with, first and foremost, at the front desk, they asked if I had a meeting scheduled. Obviously I said no. I didn't want to start out the relationship by lying to them, saying that I did have a meeting and then trying to sneak back. That's just not going to go well. So I told them I didn't have a meeting, so they gave me the materials manager's extension number. So then I called the extension, left a voicemail, she didn't answer, and then I wrote a handwritten note with my business card, put it in a little folder, and then had the front desk of the hospital deliver it to her mailbox. So that is essentially touch point number 1 for me for this materials manager. Now, it would have been nice to be able to meet with her today, get 5 minutes, demo the product, discuss next steps, do all that. Like, those are the best case scenario. Sometimes that just doesn't happen, and so yeah, this is step one, call one for this this account for me. So follow-up is going to look like trying to find an email for her. I can probably find it online somewhere where it's just going to be, you know, the app is just going to be the standard one for the entire hospital system, and then it's probably first letter of the first name and last name, or first name last name, or first name dot last name. So I'll find that out, and that'll be step two, and then hopefully get a meeting with her on the books and go from there and see if we can get these products in this facility. It's going to be difficult just because I know that they have a contract in place, but whatever, it's part of the job. You know, I think the what I was thinking about earlier is that certainly there's a very clinical side to the job when you're actually in surgery, but like I said, and I hope that this communicates when I'm doing these MedSales daily vlogs, is that you recognize how much of the day-to-day is around business building, is around sales, is around cold calling and follow-up, and figuring out how do I get my product in the account. You know, it's not nearly, this is my assumption, is it's not nearly as clinical of a role as people assume it is. Like, there are days where it's clinical when I'm standing in surgery all day, and when I'm doing demos, or I've got my, you know, first opportunity with a surgeon using my product, I need to know what I'm talking about. But, you know, the problem now, at least in this scenario, and this is very common, is that you get a doctor that likes the product, but I can't walk it into the account. So now, how am I going to be the person that's able to get this into an account where it's like, they don't want to bring a new product in. Like, this hospital doesn't want to see a new product. They don't want to see me walk in with a new product. It's not like the materials manager just can't wait to bring in the latest and greatest product. Nobody wants that. The doctors want it, but no staff member wants it. No materials manager wants it. They don't want to see new products coming in. It's just upsetting what they already have in place. They're already ordering from this company. They already have pricing established. They're already on contract. They already have, you know, everything's already taken care of. And now I'm asking this person, who is not the end user of the product, to let me bring my product into surgery. They don't want to make that happen. They don't want to allow that. So that's really where you've got to realize and recognize that when you're being evaluated for a medical sales role, or you're in a medical sales role, your value is a hell of a lot more on your ability to get products into facilities where they don't want you to come in, which is like every facility. So clinical, yes, but you've got to be tactful. You've got to be a salesperson. You've got to have an understanding of business. You got to be able to get people who don't want to use your product to be willing to use your product. You've got to find all the different variables that are going to help this materials manager say yes to me and allow me to, you know, get this product into the facility, and also help connect me to whoever else in the facility needs to have a say in new product acquisition. I've got to get that person to want to work with me. You know, that's what could be missing in some of the people that I've interacted with that are trying to get into medical sales. That could be part of the deal that's missing, that you're thinking that it's like, just, I know my product, and I know anatomy, and I know medical terminology, and I'm good in surgery. Like, yeah, that's important, but you've got to be able to get your product into facilities. That's where you've got to be strong in business and in sales and in influencing and persuading people to work with you. You know, that has nothing to do with understanding medicine or understanding products or procedures or anatomy. So, yeah, anyway, that's what we got right now. So I am going to pit stop in the surgery center next door. All right, vlog, more calls, more business cards. You know, that nature of the beast. But what you need, you know, I think one of the best benefits of cold calling, because, you know, so many times it's not like the cold call gets the meeting necessarily, but the cold call, especially at a facility where you don't have relationships, where you don't know the people that you should be talking with, the cold call is your opportunity to learn and get the contact information and or the name at minimum for the people that you should be talking with, for the people that can set the meetings so you can actually demo your product with the customer. So, cold calling, it's just the nature of the beast when you don't have any relationships in these accounts. It's a way to start it. It's not likely that the one cold call is it's just not that common where you're going to be able to walk in and set the meeting. But what you're going to be able to do is get the name and the contact information of the person that sets those meetings so that you can follow up with them and get on the books. All right, another cold call. As I was driving along, I had Google Maps taking me to one physician's office, and I'm driving along and I see on the side of a building written out essentially orthopedic surgeon or orthopedic surgery office. So I quickly hit the brakes, turn the car around, and pop back in here. And so that's really what you got to do as a rep. You got to drive with your eyes open and make sure that you're seeing what's out there, because it's easy to miss doctor's offices and things like that. If you're driving along and you're not thinking about it, you're just listening to a podcast or you're just playing music. So I popped in here, cold called on him. I got the information that I needed to, and now headed back on the road to where I was going before. Hey, quick tip for generating interest in your product. People like things that are new and novel. They like to see things that they haven't seen before. So new could be brand new, or anything that's new to somebody else is also new. So I always tell the person that I'm talking with when I'm calling on them is that we've got a new product, brand new product. Now, is it brand new? Well, no, not necessarily, but it depends on how you define it. Like brand new, if I haven't seen something before, it's new to me. So you got to use that as one technique for generating interest in your product. And you're going to have some people that are, early adopters and what's the other term? Early majority. There's one before early adopters. Innovators. You got innovators and early adopters. They're going to be all excited about new products. You're going to have some laggards and people like that. They're like, new products, I'm not sure. Most people, though, at least want to see things that are new. So use that as a tool and a tip for generating some interest. All right, boys and girls, back in the pain cave. A good buddy of mine who lives by me says started naming my basement the pain cave, where I got the gym. I don't know that it fits looking at my body type, but I'll take it. Mondays are typically best day of the week, chest and back. So another day in the life of a medical sales rep. So actually I lied. It's leg day. Got squats. I know a lot of guys out there skip leg day. Don't do that. Come on now. You're better than that.